Good morning, everyone.
Good morning.
First, I want to thank all of you all who are passionate about the rights of people, about the rights of citizens of our United States that are passionate about health care. I want to say thank you all for being here today. President Lincoln said something very powerful in the Gettysburg Address. He said that we should maintain a type of government that is of the people, by the people, and for the people.
That's right.
Washington has been hijacked by extremists
My God.
who have come to power through gerrymandering and are setting forth a kind of legislation that is self-serving.
Say that.
This new Senate health care bill is a prime example of the self-serving legislation that we see coming out of Washington, D.C., which makes it very important that we're here today. This is the kind of legislation that puts profits over people,
Yeah.
put dollars over deaths,
Yeah.
and surely puts riches over reason.
Yeah.
But we're here today to speak out and to say to Senator Burr that we the people come to express our voice and to say and to tell him to use his heart and not his connections to vote no on this Senate health care bill. This health care bill serves to take at least $800 million, nearly $800 million out of Medicaid, away from Medicaid services, to decrease Medicaid expansion nationwide, to disarm the states with the ability to expand Medicaid. And we're here today to say that we want to stand up and let our voices be heard. It is important for us that we are here today to put pressure on our elected officials to let them know that they serve at the behest of the people. And so we're here today. We thank you all for being here. We will not go away. We will not stop resisting until we see the kind of affordable health care. When we say to the citizens of America that a tax credit is a good exchange for reasonable premiums, then we have a real problem. But today we're here to say to Senator Burr no more, and to let him know that we the people will continue to resist until he votes no on this new Senate legislation. Thank you all for being here today.
Good morning. I bring you greetings from Reverend Dr. William J. Barber, who is still the North Carolina NAACP State Conference President in Washington, D.C. on the direct lines fighting. His message to us this morning: the pressure may have created a postponement, but we cannot stop now.
Yes.
But health care is a human right.
Yes.
And when senators and politicians deny health care, they are allowing inhumanity to go to the mainstream. That is immoral to all Americans.
Yes.
Our main point this morning being the Congressional Budget Office confirms that the Senate Republican legislation would cut health care for poor and middle-income people in exchange for billions of dollars in tax cuts for the wealthy and corporations. The bill would cause 22 million more to lose their health care coverage and cut Medicaid by $772 billion over the next decade. It would end Medicaid expansion put in place by the Affordable Care Act, thus ensuring that millions of low-income workers will lose health care coverages in 31 states and the District of Columbia that have opted in.
1 million in North Carolina.
It would radically cut Medicaid for all states by capping and cutting federal spending and passing significant costs on to states, essentially ensuring that they will cut their programs. It would allow states to eliminate the essential health care benefits and the minimum coverage requirements that protect people with pre-existing conditions. Here, here, here. It would cut financial assistance for private coverage and eliminate all assistance with out-of-pocket costs like deductibles. There are persons right here in our community that are among that 1,348,000 that will be impacted in North Carolina by this ugly bill that they are trying to pass. Right now, I am going to bring it closer to home. I have a mother's request to Senator Burr and to Senator Tillis and all of the politicians in D.C. Elizabeth Versman.
Hi everyone, good morning.
Good morning.
I want to say that I am very honored to be here today, speaking on behalf of myself and my mother, so thank you very much for letting me speak. I wanted to ask Senator Burr to walk a day in my shoes, in just one day. This new health care plan that the Senate is considering will cut not only my insurance, but my mother's insurance, who has uterine cancer. We cannot afford our own health insurance, and the Affordable Care Act has saved our lives by making it able for us to have insurance that it is affordable for us. I do have a pre-existing condition. In fact, I have several. It's very hard for me to stand here today and talk to you because I am in a lot of pain due to my conditions. And my mother's cancer is also a pre-existing condition. And this is something we didn't ask for. This isn't something that we chose. I don't want to be sick. I don't want to be on disability. And I, every day, do my best to get myself healthier. And I'm doing my best every day to speak out against this bill. My mother had a doctor's appointment when she was first diagnosed. It was an hour-long appointment. And it was to fit her for a radiation bed and to prep her for her radiation treatment that she would be having. This one appointment that was 1 hour, cost $70,000. That was for just 1 hour. And the Affordable Care Act made it so we had to pay very little or nothing at all on it. And every week, either my brother or I take my mother right up here to Wake Forest for her cancer treatments. I don't know the prices of those, but they range from tens of thousands of dollars and up. I ask Senator Burr to take a moment and think about what if a loved one or himself had a life-threatening condition and they went to the hospital only to find out that, oh, you're not covered. Sorry, it's a pre-existing condition. Or that your coverage had been cut. And that if you wanted this treatment, I'm sorry, but you're gonna have to pay us $70,000 before you walk out that door.
My God.
What would you do then? This isn't about politics, Senator Burr. It isn't about this politics at all.
That's
It is
right.
about people.
That's
It is
right.
about everybody standing here today. It is about everybody in these United States. And Senator Burr, I ask you, which one are you going to choose? Politics or the people that you represent? Thank you so much, everybody. I appreciate it.
Yeah. People or politics. 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 People or politics.
I know you have heard about the medical associations that will be lobbying in D.C. this weekend against this American Care Act. I am going to bring a medical professional from our community. Will Dr. Wayne Hell, MD of Cone Family Health, please come forward?
Thank you. I'm a family practice doctor, geriatrician from Greensboro, and also a member of Physicians for a National Health Plan and health care for all North Carolina. I can well remember the years before the Affordable Care Act was passed. We were regularly admitting patients to the hospital whose chronic disease was out of control due to not being able to afford medical care. So we found ourselves spending much more money rescuing them from death than what it would have cost to keep them healthy in the first place. That improved after Obamacare was passed in 2010. Millions more of our citizens were able to afford medical insurance. Pre-existing conditions were no longer a barrier to getting coverage. Incentivizing individuals to buy a plan lowered the cost for all. Older adults pay more than younger people, but not 5 times more as is being proposed currently. The ACA ensures that 10 components of medical care determined to be essential are included in insurance coverage. Yes. The ACA is far from perfect, but it is much better than the plans being offered to Congress to replace it. In both the Health and Senate plans, states are offered waivers allowing them to opt out of essential services. Do we expect our state legislators to make wise decisions about continuing essential services such as mental health and drug treatments? I sure don't. Remember, these are the people that already passed up on the Medicaid expansions and are allowing millions of our tax dollars to be subsidized Medicaid expansion in other states. The growth in costs for our health care will be unsupportable in the near future. That's an issue that we're going to have to deal with. Yes. A significant portion of this cost, however, goes to middlemen who lobby extensively to convince our representatives that they are necessary. Big Pharma persuades our legislators that they need top-dollar medication prices to ensure that drug research continues to progress. Likewise, medical insurers have funded the campaigns of legislators from both parties to ensure that they continue to be the conduit for transmitting payments for services. Traditional Medicare has overhead costs under 5%, while for-profit insurers have over 15% overhead. And this margin reminds us that these insurers need to reward their shareholders, administrators, and especially their CEOs who are getting millions for wise political contributions, not for good care. Our only hope for a sustainable health care system that will provide quality care for all residents is one that provides traditional Medicare to all. Former middlemen costs can then be directly used to fund patient care. But first we have to ensure that progress is achieved by the Affordable Care Act, that progress that we've made already is not lost. So I am for universal health care, but clearly we need to support, we need to not throw out the Affordable Care Act, but rather build on it to have a better health care system.
Thank you so much. We are for building on health care to create a healthy America, which will help America to grow. Right now, we have a kidney donor that will be impacted by this act and is impacted economically already because she is already impacted because she is fighting to raise the minimum living wage to $15 while trying to get a kidney. I will bring to you Ms. Wanda Cougar at this time.
Hear, hear.
Good morning.
Good morning.
We are here once again demanding that Senator Burr vote with the people of North Carolina in mind and not big businesses.
All right.
It is a shame that in this country, people are dying simply because they can't afford quality health care. This issue is very personal to me. I am currently facing thousands of dollars in medical bills for a kidney transplant while working as a manager at Burger King. I joined the fight for 15 because having a higher wage means that I would be able to afford better health care.
Yes.
I work for one of the richest companies in the world, and I still can't afford a surgery that I need. The proposed health care bill would drop 22 million people from coverage and cut $800 billion in Medicaid spending.
My God.
Senator Burr must not know that over 1 million children and 40% of people with disabilities in his state depend on the Medicaid program. In this country, no one should have to decide whether to pay their bills or get their prescriptions.
Yes.
No one should have to suffer in silence and in pain because they can't afford affordable care. I'm here today because Senator Burr needs to do his job.
Yes.
Absolutely.
Pass legislation that helps communities in North Carolina, not punish them for being poor. Senator Burr, this is an issue of life and death for all North Carolinians. And we will not back down until you support a bill that will truly provide care to those who need it most. Thank you.
All right, all right. Yeah.
Thank you so much, Wanda. Prayers be with you, my sister. And at this time, you know, movement. We fight, but we pray first. And we need all the clergy across this country to be involved in this egregious fight. So we're calling on clergy members and others to join the fight to save health care. At this time, I am going to bring you the third vice president of the North Carolina State Conference, Reverend Dr. T. Anthony Spearman, who also serves as the president of the North Carolina Council of Churches, along with Jennifer Copeland, to stand with him as the executive director of the North Carolina Council of Churches.
Let us give Sister Daphne Holmes Johnson a round of applause. And as much as this contraption here is able to carry my voice, we'll hope that it does, but if it doesn't, I'm going to use my preacher's voice. Let everybody say amen. Amen. The North Carolina Council of Churches has been a staunch advocate of health care for all citizens since her inception in 1935. The 18 denominations, or 6,200 congregations, are comprised of more than 1.5 million members across the state of North Carolina who are devastated knowing that the Senate of the United States would craft a plan and give it the moniker the Better Care Reconciliation Act. Know this, Senators Burr, Tillis, and other United States senators who were elected by the people to make laws that would improve the quality of life of all Americans, that reconciliation is that which would improve the quality of life and brings things into peace and harmony. Reconciliation is about improving on something that already is. Yet your so-called Better Care Reconciliation Act decimates Medicaid, locks the poor people out of health care access, and repeals cost-sharing subsidies. Where is the reconciliation? Why would you attempt to deceive us into believing that you have our best interest at heart, when the best this act offers is to render those who are already vulnerable even more vulnerable? This act is a malicious intent to shed the blood of the poor among us. Jewish law, as found in the Torah, or first 5 books of the Bible, sees preservation of life as its highest goal, so that we are commanded to take all reasonable action, including the practice of medicine necessary to protect, I said protect, human life. It is our duty to rescue those in danger and not stand idly by the blood of our neighbors. Where is the rescue hatch to better care? When will you open your bowels of compassion to reveal a love for all humanity? When will you take time to sit among the poor, the sick, and the wretched to calculate the true cost of healing lives in these United States of America? Inasmuch as the vote has been delayed, my prayer is that each of you would proceed with caution and reconsider the oath of office you once took. If you did not utter the 4 final words, "So help me God," I implore that you revisit your oath and seek his face while he may be found. No good law can be made apart from God. Every life you were elected to serve is precious in his sight.
Every life that you were elected to serve was created in his image and after his likeness. Please reconsider your plan of reconciliation. And remember that when your constituents gather by the side of the road and are left hungry because of the mean-spirited policies that you were elected to feed them, when your constituents become thirsty, give them something to drink. And when they get sick, the many who have lived lives supporting this country with their taxes, your lot is to create policies to improve their lives and not destroy their lives. That is what reconciliation is all about. Senator Burr, please, during these days that you reconsider what you've done or what you plan to do, think about the least, the last, and the lost of God's people.
Reverend Dr. T. Anthony Spearman. Thank you, thank you. We will now have the Reverend Dr. John Mendez of Emmanuel Baptist Church encouraging the clergy. Come on, my pastor.
Thank you, thank you. I'm not going to be redundant. The facts have been laid out. We know why we're here, and we know what we must do. Dr. King said some years ago that the oppressor does not voluntarily surrender power or freedom or do the right thing. It must be demanded by the oppressed. I've asked myself numerous times after this secret bill was hidden from the people, what's up with that? Well, it's very clear. Empires want to keep the poor oppressed because it enhances their domination, their control, and their further oppression.
That's right.
We are here because there is a determination by this president, this Congress, and this state legislature who want to further empower themselves. And in order to do that, they got to keep the majority of the people oppressed, powerless, and weak. But as I look around this morning, we are anything but weak. And we are anything but powerless. What they don't understand, they serve at our privilege. We elected them to do the right thing. And the trade-off is evil. The trade-off is to make the rich richer and the poor poorer. But we come here to say that we're not going to stand down. We're not walking backwards. And we don't have to accept policies such as these or any other kind of oppressive legislature. I'm glad to see all of you out this morning. You look beautiful. And don't think they're not looking at you. And don't think for a minute McConnell would not have canceled this vote if in fact they don't have the votes. We got to keep the pressure. We got to continue to stand up. This is not a one-day struggle. This is a progressive, enhanced struggle. And we got to stand and fight until we got the victory. And I submit we will get the victory. We always have, and we always will. So now stand up, reach up, pull up, get up, fight up. But for God's sake, never, never, never give up.
The people united can never be defeated. 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 The people united will never be defeated. The people united will never be defeated.
All right. At this time, I am going to call on Reverend Alvin Carlisle, the president of the Winston-Salem branch of the NAACP, to read the letter that is being signed to take into Senator Richard Burr's office. We're going to proceed in a march, the people out here with your signs in a procession to take the letter. Oh, I'm sorry. We're going to proceed in a line after the reading of this letter. I need my RIPs to gather around and take the letter in to Senator Burr. But right now, Reverend Alvin Carlisle is going to read that letter.
And the letter reads, Dear Senator Richard Burr, on behalf of the North Carolina State Conference of the NAACP, we are writing you to express how disappointed we are to know that many of our brothers and sisters in this great state will soon have to choose between paying for a meal or paying an egregious amount of money every month for health care. For someone living at the $12,060 poverty level, they would have to pay almost half of what they make annually for adequate health care. Senator Burr, that means that you will have to apologize to over 30% of your constituency for denying them the right to adequate health care. Out of 22 million Americans who will be denied health care under American Health Care Act, 1,348,300 are North Carolinians. We do not want this harsh reality to come into fruition, and we ask that you support the people that you represent and vote against this killer health care bill. And support legislation that would expand Medicaid, provide health care to everyone. Health care is a human right and a moral requirement. Senator Burr, as an elected official, you receive the best health care. And now that you have obtained temporary political power, you are denying the people who elected you the same health care. Now is the time to change your course and begin to govern for the good of the whole. We call on you to fight to expand Medicaid, to save the lives of thousands of North Carolinians. Every year, we call on you publicly, we call on you to publicly reject the American Health Care Act and the attempt to roll back the progress we have made as a nation. Yours in truth and justice, the Reverend Dr. William J. Barber II, President of the North Carolina NAACP.
There is a letter that's going around that needs your signature. If you have not signed, please let us know at this point. I have some people on this side that have not signed, and I have some hands over here that have not signed. We want it signed, and Reverend Dr. T. Anthony Spearman is going to lead the funeral procession to take the letter in to Senator Burr.
Yes. All right.
Before that happens, we have a few people here that want to come forward and with their RIPs come together, and if you can read your RIP statement, and then the others are going to start following me down to Richard Burr's office, Senator Burr's office, where we will deliver the letter that was just read to you. And if you have not had a chance to sign it, there are letters that are coming around for your signage, and we pray that each of you would receive it before it is delivered, or they are delivered to Senator Richard Burr. Those of you that have the RIP statements, please come forward.
I died from complications of common cold and due to the fact that I could not get affordable medical treatment.
Expand Medicaid now.
Expand Medicaid now.
I died from complications of diabetes because I could not afford my medication.
Expand Medicaid now!
That's right.
I died from complications of a stroke due to hypertension because I could not afford medical treatment.
Expand Medicaid now!
I was born with a pre-existing condition. Under the new American Health Care Act, I will not have Medicare coverage and I will die. Expand Medicaid now!
I died from complications of breast cancer because I could not afford to have a mammogram.
Expand Medicaid now!
I died from complications of heart disease because I could not afford medical treatment.
Expand Medicaid now!
I died from complications of HIV/AIDS because I could not afford medical treatment.
Expand Medicaid now!
Good job.
Expand Medicaid now! Expand Medicaid now! Expand Medicaid now! Expand Medicaid now!
Expand Medicaid now!
Let us all make our way to the office of Richard Burr to deliver these messages. Expand Medicaid now!
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare. Now. Healthcare. Now. Healthcare. Now.
What do you want?
Healthcare.
What do you want?
Now. We're not protesting. We're going to deliver a letter. We're not protesting. Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do you want?
Healthcare. Now.
We want to deliver a letter to Richard Burr's office.
Now.
What do you want?
Healthcare.
Please go to the other
Now.
back on the
Now, okay, so apparently Burr's office has gotten frightened that we are here and has allowed only 2 people to go up and deliver the letter. So thank you all for coming up here.
But we're going to go back on the sidewalk and let Richard Burr know that you can not deny the people, because the people united will never be defeated. The people
united will never be defeated.
Will never be defeated. The people united will never be defeated. The people
United will never be defeated.
Sir,
United.
you have to leave property. I'm asking you to leave property.
Ron, did you sign one of these? Ron, did you sign one? Yeah, that's right.
If it gets fell, it's going to affect those folks. Ma'am, let me just say, it is.
You sound like a reasonable person. I need you to get the people back on the sidewalk, because right now they're breaking the law.
Can we have someone from Senator Burr's office meetings down here to deliver?
I can do that.
Can you please
But
do
can
that?
you get it back on the sidewalk, and I will get someone down here.
Thank you.
Okay, all right. So as soon as you get back on the sidewalk, I'll get someone
Can you,
down.
by the time you get downstairs, the people will be off the
I
sidewalk.
can't leave until you get someone
Okay.
down.
Well, sir, can
Get
you?
back on the sidewalk.
Yeah, while you're up here running your mouth. Would you mind going to get somebody to get them?
Going to be, the 2 of us will go.
No, we want Senator Burr to see the folks that are going to be impacted. So since they're not going to let all the people come out,
Is Senator Burr here?
I couldn't tell you that. I don't know that.
Okay.
But if you would get back on the sidewalk, I will see if we can get someone down.
Right, exactly. Exactly. We wouldn't have told her to come down here and tell us that. We can't deliver a letter.
Bring them down.
I'm already saying
When you all go out.
Protest on this property.
I'm not protesting, I'm a supporter.
Okay.
Two of us said we're trying to bring someone down from Richard Burr's office.
Okay, who's the two that's going down? You two?
Yep.
The cameras have to stay. In fact, you need to leave property. I've asked you to leave property. You're trespassing. You're trespassing. I've asked you to leave property. Because I've asked you to leave property.
But what am I doing illegal?
So who are you with?
I'm with them.
All right, you two can go. Yes. Give me an ETA. I need some help here.
We're going to continue our
But just you let Burr know that we know what he's doing. You let him know.
What do you want?
Healthcare. Now. Healthcare. Now. Healthcare.
Healthcare! Now! Healthcare! Now! Healthcare! Now! Healthcare! Now! Healthcare! Now! Healthcare!
They don't even know whether you
can't even see your representative. Healthcare! Now! Healthcare! Now! Healthcare! Now! Healthcare!
Hold on, everyone. So, as you all noticed, we tried to march in so Senator Burr's office could see the faces of those North Carolinians that he represents that will be impacted by this killer health care bill. So instead of us being able to see our lawmaker, because the Constitution says we have a right to actually address our lawmakers, we were denied access to his office. So what we've asked is for someone from his office to come down and see the people. Yes. So what we're going to do is keep chanting and keep protesting, let these folks know that you can hide behind closed doors, but the people are not going to go anywhere. Yes. We're not going to back down, because when we stand together, injustice will come down, racism will fall down, and we, the people, will rise. Yes. So when the people united will never be defeated. Yes. The people united will never be defeated. The people united will never be defeated.
The people united will never be defeated. The people united will never be defeated. The people united will never be defeated. The people united will never be defeated.
You need to move to the sidewalk. The police is on the way.
The people united will never be defeated.
The police is on the way. Okay, you need to move to the sidewalk.
All of us are just me.
You need to move to the sidewalk.
All of us are just me.
You need to move to the sidewalk. That's what I'm telling you.
I understand.
That's
All
what
of
I'm
us are just me.
You need to move to the sidewalk.
I heard you.
All of you need to move to the sidewalk. Okay?
The people united.
The people united will never be defeated.
Scared to come out.
United will never be defeated. The people 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 united will never be defeated. People united will never be defeated. The people united will never be defeated. Healthcare! Now! What do you want?
So what did they say?
Huh?
What they say?
They want us to stay in the boundaries of the permit. Yeah. The people united will never be defeated. The people united will never be defeated.
Earn your 750. Earn your 750.
Erica, what happened?
We gave a letter to Burr's assistant. Yeah. And yes, we did. Yep.
Oh, please.
And we tried. Senator Burr's not here. His chief of staff is. And his chief of staff wouldn't come down. He claimed he was in a meeting.
And he's going to be the one that leads this.
No, I know. I'm not. I just want to know what
and
the
protest. I fought for a year in Iraq so you could do it.
Yeah.
Okay? But it says on the curbside. You're in. Right. So when people start coming over here, this is technically, not technically, it is Wake Forest private property. Okay. And that's all I'm doing.
Okay.
Again,
I figured there was a city
Please
easement of
please
certain
pick
number
it
of
as
feet.
much as you choose to do. You just got to stay within the confines of the permit, okay?
Get into
That I don't know.
Would you take one of our signs and hold it up?
Well, you got to turn it. That's probably why you can get health
that way.
Would you take one? Would you take one to them? For everybody to get health care, not just us. Talking about everybody.
That's it. Me as a law enforcement officer, I don't take their side. I had to stay neutral.
We're not doing it, but giving you a paper to take up there.
I have no reason to just go in there.
He's doing his job. Thank you for your service, sir.
Thank you for your service.
What are we going to do? We're doing a picket line right here on the sidewalk. So this front line, if you could start walking this way, back line that way, and we're going to do a looping picket line right here on the sidewalk.
What do we want? What do we want?
Closest to the sidewalk.
Healthcare.
That way.
What do you want? Healthcare. Now. Healthcare. What do we want?
Healthcare.
When do we want it? Now. What do we want it?
Healthcare.
When do we want it?
Now. Healthcare.
Now. Healthcare. Now. Healthcare.
I'm gonna try to keep it going.
believe you. Let the people hear you.
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do you want?
Healthcare.
When do you want it?
Now.
What do we want?
Healthcare.
When do we want it?
Now.
What do we want?
Healthcare. Now. Healthcare. Now. Healthcare. Now. Healthcare.
Be heard, and then apparently they're going to start arresting us on the dot. Right. Because our permit's from 10 to 11. The permit is at 11. Sorry.
Now. Healthcare. Now. Healthcare.
When do we want it? What do we want? When do we want it?
Shut it down. Shut it down. Shut it down. Shut it down.
Shut it down.
Shut it down!
No justice!
No peace!
No justice!
No peace!
No justice!
No peace!
What do we want?
Healthcare!
I can hear you. When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
I don't hear you. When do we want?
Healthcare!
When do we want it?
Now!
What do we want?
Healthcare!
When do we want it?
Now!
What you come out here for?
Healthcare!
When do you want it?
Now!
What do we want to?
Healthcare!
Now!
We need to trust you. Like that's so out of question. Yeah, you do. Yeah.
Tweet it out. We're gonna leave. Our permit expires at 11 a.m. Don't want anyone arrested? Go home on social media and tweet it out.